On this instructional tape, you will find important and valuable information about Therapy Plus. You'll get first-hand instruction from Dr. James McElhaney, who has treated hundreds of pain sufferers. He'll show you how to get the most out of Therapy Plus. And now, here's the spokesperson for Therapy Plus, Roger Barkley.
Hello there, and thank you for your purchase of Therapy Plus. We've prepared this instructional tape so that you will be able to maximize the effectiveness of your Therapy Plus in your own home. The nice thing about it is you can apply it yourself. It adjusts so that you can work it wherever you feel the need. There are some specific areas on your body that perhaps you need more medical type instruction on, and that's why we have prepared for you this tape with Dr. James McElhaney, who is the medical director for Therapy Plus.
Although Therapy Plus is an incredible yet simple device, we felt that an instructional tape which demonstrates the proper use of the instrument would help you achieve its maximum benefit. The design of the single roller makes it extremely effective for self-treatment. It has the capability to be adjusted to reach just about any area of the body. In most cases, it can be self-administered. However, in some places like the back, it is helpful to have someone else apply the roller. We will deal with specific areas of application in a minute, but first a few things to remember. This is the way to hold the roller. Place your thumb and index finger on the handle. Most of the pressure should be on the thumb and index finger. Very little pressure should be applied on the palm of the hand. The most important thing to remember is to roll the device lightly and rapidly across the skin. Do not apply any pressure. There should be just enough friction to cause the wheels to turn. And use quick strokes back and forth, about 3 to 4 per second. Therapy Plus should be rolled directly onto the sore or stiff area. 3 to 8 minutes should be sufficient for relief. If needed, roll twice per day. There are a few areas where Therapy Plus should not be used. Do not use it in areas that have been anesthetized or have been burned or those which have open sores. Also, do not use the roller if you have unexplained pain in the calves of your legs or where you have varicose veins. Never use Therapy Plus on the abdomen when pain is present, and never on genital tissues. If you have any doubt of the cause of your pain, consult a physician before using this product. Now we're going to discuss some specific areas of application. Remember, Therapy Plus is usually applied by yourself. However, for the purpose of this instructional tape, I will demonstrate the correct use. Daily stress can manifest itself as stiffness in the upper back and neck. For this type of discomfort, start with the upper back and then the neck. This is especially relaxing after a tense day at work when you feel a tightness in the upper back. Usually 3 or 4 minutes on each side is adequate. For sprains and strains in the neck area, they should be rolled similarly, but will require a few more minutes of treatment in the area being rolled. For minor arthritis and stiffness or other pain in the hands, roll the inner aspect of the fingers. Only one side of the joint need be rolled. And then the palmar surface of the hand at the first joint of the thumb. On the wrist, just roll the tender areas, and once again, roll quickly and lightly. For pain in the elbow, which may be associated with tendonitis or arthritis, roll the most tender areas. For tendonitis, in this area, in the outer aspect of the area of the elbow. For arthritis, Often the area must be rolled near the elbow. And in some cases of arthritis, one must roll the inner aspect of the arm. Again, roll for 3 to 8 minutes. Remember that the tender spot is the best place to start. Frequently, the area which is being rolled turns red from an increase in local circulation. This is not an irritation of the skin. It is normal. If shoulder pain exists after rolling the shoulder area, examine the back near the shoulder blade, the scapula, and look for a tender spot. This may often be a trigger which can cause radiation of pain to the shoulder, and this then is the area that should be rolled. For back pain, again, find the most tender spot and roll lightly for 3 to 8 minutes. On the ribs, just roll the most tender area. The same goes for the knees. However, best results for arthritic pain have been achieved by rolling the inner aspects of the knee. However, again, the knee should be carefully examined to find the most tender spot, because occasionally there's a tendonitis in front of the knee, and this is the place that should be rolled for 3 to 8 minutes. As I mentioned earlier, Therapy Plus should not be used on the calves when unexplained pain is present. This may be a symptom of a blood clot, and a doctor should be consulted if there's any doubt. On the ankle or foot, again, find the most tender area, and again, roll very lightly, very little pressure, only the thumb and index finger. If any pain is not relieved by Therapy Plus, a doctor should be consulted for that specific problem. You can clean your Therapy Plus roller by simply rinsing it with warm soapy water, or you can use a rubbing alcohol solution, but only on the metal part. Do not use alcohol on the handle. Dry it with a towel. Remember, the main point is to roll lightly and quickly to get best results from Therapy Plus. You may have purchased this device for one particular pain. Should another pain occur elsewhere in the body at a later date, remember to use your roller. Review this tape often to assure correct use of Therapy Plus. Proper application is the key to freedom from pain.